I'm Dr. Muna Adil Ismail from Al-Farat Al-Awsat Technical University, Technical Institute, Kufa Department of Medical Laboratory Technique, Iraq. My research title, Epidemiology of Hydatid Cysts Liver Diagnosis in Najaf Governorate. Introduction. Hydatid disease is a health, social, and economic issue in the Eastern Mediterranean region and the severity of infection in common in those areas because dogs are widely used in the care of cattle and sheep herds. These animals have direct contact with humans. This contact resulting in continuation of infection chain that include dogs, sheep, cattle, camels, goats, and other animals meat eaters. In Iraq, the disease is epidemic and considered a serious health problem, particularly in the center of southern region between Euphrates and Tigris. This area are inhabited by many farmers who produce grains and raise sheep, as well as the presence of factors that contribute to cyst disease, separate, and the presence of intermediate host disease. The purpose of this research is to determine the relationship between Hydatid cyst and various variables. We will attempt to determine whether there are differences in incidence rates between males and females, as well as age group and other factors. We will attempt to quantify the effect of variety of factors on the Hydatid cyst cases, including location of infection in human body, also the type of infection, whether multiple or individual. We will also attempt to demonstrate the impact of geographic area, both urban and rural, on the incidence of Hydatid cyst. Material and method. This study includes patients who were admitted to Al Sadr General Hospital for a period from 1 January 22 to 31 December 22, who had Hydatid cyst. The study was conducted on the basis of a study of the number of cases with Hydatid cyst for patients who were treated surgically in Al Sadr Technical Hospital during the initial diagnosis. A study of the number of cases actually infected with hydatiform cyst in the liver after their surgical operation in Al Sadr General Hospital, where the confirmatory diagnosis was made. The initial diagnosis of the cases was made based on clinical examination by a doctor, X-ray examination, ultrasound examination, and other type of test. Result. In the following tables is the main result of the research. Table 1 shows relationship between the age and sex of infected patient. Table 2 explains the relationship between sex of patient and the affected organ, while Table 3 explains the multiplicity of Hydatid cyst and single infection among the sample. Table 4, relationship between age group and multiplicity of Hydatid cyst. Table 5, the table shows percentage of infection by area of residence. And Table 6, the table represents relationship between the patient gender and type of work. Discussion. These findings show that Hydatid cyst is still a problem in Iraq, despite advances in science and technology after 2003. Furthermore, because the majority of those infected are families, it's take more attention and effort to discover the disease for them than for males. By conducting health education campaigns to inform them of disease symptoms and how to prevent it. teaching women how to wash vegetables and fruit, particularly leafy vegetables, which must be washed and sterilized before consumption, because women are more responsible for cooking than men. Attention must be paid to hygiene and food preservation rules. In addition, women are encouraged to through cook meat in order to kill any worm that may be present. In addition, medical examination can begin to be carried out in order to detect the disease early. This result indicates that the treatment of this disease necessitates a surgical procedure to eradicate it and reach the stage of recovery, and that this matter necessities a sum of money in order to eliminate this disease. The separate of this disease imposes significant costs on both the family and the state. Conclusion: Echinococcus granulosis can cause cystic lesion anywhere in the body. Thus, cystic echinococcus has to be thought of as differential diagnosis in patients presenting with cystic swallowing anywhere in the body in endemic area, unless otherwise provide. Appropriate investigation have to perform in order to arrive at accurate diagnosis and in order to prescribe a specific treatment, which is essentially surgical. Thank you for listening.